I'm here to administer an IM medication, and I'll start by confirming that I have my school uniform, I have my badge, and I have the shoes appropriate for the skill. I will be doing an IM injection, and I've gathered my supplies. I have the medication here. I have the syringe, which is 3 ml syringe. I have the brand needle to draw the medication here, and I have my needle, which is gauge 22, that I'll be using to administer the medication, and I have cream gloves. I will then go ahead and I will first by confirming from the AMA whether the medication that I have at hand is what the physician want me to provide. So the order says 6 milligrams, but the medication that I have, it reads 4 milligrams in 1 ml. So if I do my calculations, I'll be administering 1.5 ml of morphine sulfate, and I have confirmed on the EMA and on the physician orders, and everything seems to tally. So I'll go ahead and approach the client. I will provide privacy, perform heart hygiene. Good morning, Mrs. Smith. My name is Valentine, and may I use your wristband to confirm your name and date of birth? That tallies with my record. So the reason I'm here is because I have some medication for you. But before then, can you confirm whether you have any allergies to food, medication, or any season of allergies? Okay, then I'll go ahead and provide the medication that the physician wants. I have morphine, which is your medication for pain. This medication is used for severe to moderate pain, and it works it's an analgesic opioid, and it works by suppressing the feeling of pain throughout the body. It works on the pain receptors, hence reducing the pain perception in your body on your CNS. So when you're taking this medication, when you might experience some side effects, which include lightheadedness, you may experience some nausea and vomiting and constipation. You may also experience some form of adverse effects, which include vertigo, tachycardia, and I want you to report just in case you have this feeling. You may also experience some burning and tingling sensation when you are administering this medication. I want you to report just in case you have any of these effects. It will be good to let your doctor know that we're having this kind of issues. Do you have any questions for me so far? So then I'll go ahead and perform heart hygiene, don cream gloves. I'll then go ahead and clean the cup of my medication. I'll do that in circular motions for 30 seconds. That's what I'm gonna do. And I'll dispose of in my garbage bin. I have my syringe, my 3 ml syringe, and I have my brand needle. So I'll go ahead and open this just a little tiny bit, not all the way. I'll place it there. I'll go ahead and open the brand needle. Not all the way, but I'll have it there. So I'll go ahead and take hold of my syringe, remove it from the packaging, put that in the trash, and I'll be careful. I'll only hold the barrel, and I will twist in this all the way tight. I'll go ahead and remove the cap with the cover. I will draw 1.5 ml of air 1.5 ml of air. I'll then go ahead and at an angle of 45 degrees with my bevel up, I will hit the jackpot on the bull's eye, and I'll do a 90 degrees. I will inject the air. I'll invert the medication, the vial, and I will draw 1.5 ml. Making sure that I don't have any bubbles in there. Yep. I will move this. And I'll show this on camera that I have 1.5 ml of the medication. I'll then go ahead and dispose of this. Before then, let me open the needle that I'm going to be using. It's a 22 gauge needle that I'll be using to administer the medication. So I'll open up this. I'll put that in the sharps, and I will introduce the new needle. I'll leave it like that, set it down so that I can clean the area that I'll be injecting. Have this away, have those away. So I'm gonna bring this closer to the camera. So I'll go ahead and clean the area that I'll be using. So I will, my client wants the retrogluteal area, and that's what I'm gonna be cleaning. But before I clean, I want to inspect the area, assess for any mass or any damage on the skin. Make sure that the skin doesn't have any masses or any discoloration, and I have confirmed that. Then I'll go ahead and perform an radmark for where I'll be, anatomical radmark for where I will be injecting the medication. I want to move this a little bit to the camera, closer to the camera. So what I'm gonna do, I'm gonna use my finger, my pointing finger and my thumb on the trochanter of the ventral gluteal area. I will press it like that, and I'll try to identify them on the V. That's where I'm gonna be injecting I'm gonna be doing my injection. So on the trochanter of the hip, that's when where I'm gonna be that's how I'm gonna identify the V on where I'm gonna be injecting. So I have pointed out where I need to inject my medication. So I'll go ahead and clean the area. Circular motion 2 inches away from my radmark. Flush that, and I'll wait for the side to dry up. I don't want to reintroduce that on that area. So I will then go ahead and handle my needle, and I'll remove the cap. I'll remove the cap, ready for that, and I'll hold it like a dart. Then I'll go ahead using my the heel of my hand. I'll pull it out and use my fingers to stretch the skin, being careful not to contaminate the area that I cleaned. At a 90 degrees angle, I will inject. And then I will use my 2 fingers to secure the syringe, and I'll use my dominant hand to inject the medication, 10 milligrams per second, 1 milligram per 10 seconds. So I'll do it like that. I will not cap the needle. I'll put it in the sharps. I will Use a bandage to gently press. I'm not gonna massage, I'm just gonna press and check there's no blood coming out. And I will remove my gloves, perform hand hygiene, and document. Thank you.